Consciousness is our ability to experience the world around us. And when we have a conscious experience, we can easily tell other people about those experiences using our words and our gestures. But for millions of patients who suffer from a disorder of consciousness, they're not easily able to express those experiences, and in some cases it might be impossible. And this presents a profound challenge in the medical community because many of these patients who are conscious are categorized or diagnosed as being unconscious because they're not expressing their experiences in the way that we would expect. To better serve these patients, we need a new approach for detecting consciousness that doesn't require you or these patients having to tell us that they're conscious. And in the Hal Blumenfeld lab, we think this new approach for detecting consciousness can be found in the eye, and in particular, that black circle at the center of the eye called the pupil. Now, we all know the pupil is very reactive to the light in the environment. So for example, if you're on a sunny beach, your pupil gets small, but if you're in a dark room, your pupil will get larger to allow more light into the eye. But you might not know that the pupil is also very reactive to the state of your brain. So for example, if you're tired or bored, your pupil will actually get smaller. If you're excited, engaged, or giving a 3-minute talk about your thesis, your pupil is gonna get bigger, okay? So we think because of this relationship between the size of the pupil and the state of your brain, we might be able to predict when someone's conscious based off of the size of their pupil. To test this, I recruited dozens of participants to complete a computerized consciousness test, all the while I was recording their pupils. And this test was very simple. I showed my participants hundreds of faces that were intentionally really hard to see, and they pressed the button anytime they noticed one of these faces. I then took all the faces that my participants said they saw, and all the faces that they didn't see, and I analyzed what did the pupil do after they were conscious of the face, and what did the pupil do after they neglected or didn't see one of the faces. So what I found is on average, when you're conscious of the face, your pupil gets bigger, it dilates. But when you don't see the face, your pupil stays the same size or gets smaller. But what I wanted to do next was even more challenging. I wanted to be able to predict, did you see a particular face? So this is like trying to determine, were you conscious at an instant in time somewhere in the past? To do this, I took all that data and I fed it into what's called a machine learning classifier, or a predictor. And this predictor's goal is to try to learn from all of this data and guess whether or not you saw a face. And by manipulating the parameters and the architecture of this predictor, I was able to get it to more than 95% accuracy in predicting whether you saw a face. This is a really exciting result because we might be able to use this in a clinical setting to predict consciousness in patients with disorders of awareness, and it offers new opportunities for studying consciousness in the healthy brain. Thank you very much.